All right, buckle up everyone, because today we're taking a deep dive into the world of gastroenterology.
You might not think it's the most glamorous topic at first glance.
But trust me, there's a whole lot to uncover here.
It's something that affects us all every single day.
Exactly. We all eat, we all digest, and sometimes, well, things go wrong.
And when they do, it's good to know what's going on, right?
Absolutely. So today we're going to take a comprehensive look at this whole chapter. You want the key theories, the important concepts, the research, even those fascinating case studies, right? We've got you covered. Ever wonder why heartburn feels the way it does? Or what actually causes ulcers? Well, get ready to find out.
We're going to break it all down.
So let's begin our journey right at the top with the esophagus.
The esophagus.
Our first stop is GER,
GERD stands for Gastroesophageal Reflux Disease.
which you might know better as heartburn.
And get this, a whopping 60% of people experience it at some point.
60%. That's huge.
It's incredibly common. And while most people only have occasional heartburn, for some, it can be a chronic problem.
That's a chronic problem.
Yeah, and the key to understanding GERD is this thing called the lower esophageal sphincter.
The lower esophageal sphincter.
It's a ring of muscle
Okay.
that acts like a valve between your esophagus and your stomach. So think of it like a doorway between two rooms.
I like that.
When it's working properly, it keeps all that stomach acid contained where it should be in the stomach. But when it weakens or relaxes at the wrong time, acid can splash back up.
Oh, that makes sense.
And that's what causes that burning sensation.
Like a leaky faucet, but with acid.
Exacts.
Ouch. And I've heard that if it's not treated, GERD can lead to some pretty serious complications.
Oh, absolutely. A chronic acid exposure, it can really irritate the lining of the esophagus. And this can lead to something called Barrett's esophagus.
Barrett's esophagus.
And this is where the cells lining the esophagus actually start to change. And it increases the risk of esophageal adenocarcinoma.
Adenocarcinoma.
Yeah, a type of cancer.
Oh, wow. That's definitely concerning. So it's not just about treating the symptoms. It's about preventing long-term damage.
Right.
But how do you even know if your heartburn is a sign of something more serious?
Well, occasional heartburn is normal. We all get it. But if it's happening a lot, or if it's really bad, or you're experiencing these other symptoms like regurgitation, hoarseness, or chest pain, you should definitely see a doctor.
Chest pain. That
Yeah.
sounds a little bit scary.
Yeah,
I'm guessing doctors have a lot of tests to figure out what's really going on.
they do. The gold standard is endoscopy.
Endoscopy.
This involves inserting a thin, flexible tube with a camera into the esophagus.
Okay.
It allows us to actually see the lining of the esophagus, directly, and take biopsies if we need to. Imagine it like a tiny submarine.
A tiny submarine.
I love that. Exploring your digestive tract.
Wow.
Sometimes we use a barium swallow.
A barium swallow.
You drink this contrast solution that shows up on X-ray, and we can see the shape and the function of the esophagus. And then in some cases, we might use a test called ambulatory 24-hour pH monitoring.
24-hour pH monitoring.
This is basically like a heart monitor, but for your esophagus.
For your esophagus.
Yeah, it tracks the acidity levels over a whole day, so we can see how often and how much acid is refluxing.
So there are a few ways to get a clear picture of what's happening.
Right.
So once you know it's GERD, what's the game plan? What can you do to treat it?
Well, the good news is there are a lot of options.
Okay, good.
Lifestyle changes are often the first step. So avoiding large meals, not eating right before bed, and elevating the head of your bed can help.
So simple changes can make a big difference.
They really can.
But what if that's not enough?
Then we can move on to medications.
Okay.
Antacids, they provide quick relief by neutralizing stomach acid.
Neutralizing stomach acid.
Yeah. Then there are H2 blockers. They actually reduce the amount of acid your stomach produces.
Okay.
And for the more severe cases, there are proton pump inhibitors, or PPIs. PPIs.
And these are really the most powerful acid suppressants that we have.
Wow. So there's a whole spectrum of treatment options.
There is.
But before we move on, what about those medications that can actually make heartburn worse?
Yes. You're right. Some medications can make GERD worse.
Okay.
Certain antibiotics, iron supplements, and even common painkillers like NSAIDs, they can relax that lower esophageal sphincter.
The lower esophageal sphincter.
Yeah, or they can irritate the lining of the esophagus,
I see.
making symptoms worse.
That's good to know. I guess it's always important to talk to your doctor about any potential side effects,
Absolutely.
especially if you're already prone to heartburn. All right, let's move on to something that sounds a bit scarier. Infectious esophagitis.
Infectious esophagitis.
What exactly is that?
Well, it basically means that the esophagus is infected,
Okay.
usually by a fungus, a virus, or even bacteria.
Okay.
Now, it's not that common in the general population,
Okay.
but it can be a serious problem for people with weakened immune systems. So for those with compromised immune systems, this is a real concern.
Absolutely.
So what kinds of infections are we talking about?
Well, we see fungal infections,
Mhm.
particularly Candida. You might know that as the cause of oral thrush.
Okay.
And then there are viral infections.
Viral infections.
These can be caused by cytomegalovirus or CMV, herpes simplex virus or HSV, and Epstein-Barr virus or EBV.
EBV.
These are all different types of viruses that can affect the body, and in this case, they can affect the esophagus.
Okay, so a whole range of potential culprits. How do doctors figure out what's causing this type of esophagitis?
Well, symptoms can give us some clues.
Right.
But to get a definitive answer, we usually do an endoscopy and take biopsies of the esophagus.
So we can see exactly what's going on.
Right. This allows us to look at the tissue under a microscope and identify the organism causing the infection.
Like a detective story, but for your esophagus.
Exactly.
And once you know the culprit, how do you treat it?
Well, the treatment is going to depend on what's causing the infection. If it's Candida, we use antifungal medications. If it's a virus, we use antivirals, and so on.
So a targeted approach makes sense.
The key is to identify the underlying cause and treat it.
Okay, let's shift gears a bit and talk about something called esophageal dysmotility.
Esophageal dysmotility.
That sounds complicated.
Well, it's actually pretty straightforward. It basically means the muscles of your esophagus aren't working properly,
Right.
and this leads to problems swallowing.
I see.
Imagine trying to get food down, but the muscles aren't contracting properly.
That sounds very frustrating.
It is.
Are there different types of esophageal dysmotility?
There are, and they can show up in different ways.
Okay.
For example, achalasia.
Achalasia.
This is where the lower esophageal sphincter doesn't relax properly, making it hard for food to pass into the stomach.
It's like a door that's jammed shut.
Exactly. And then there's diffuse esophageal spasm.
Diffuse esophageal spasm.
That's where the muscles contract in this uncoordinated, painful way.
Like they're spasming?
Ex-
Oh, that sounds very uncomfortable. What about scleroderma? Doesn't that affect the esophagus too?
You're right. Scleroderma causes tissues to thicken and harden, and when it affects the esophagus, it can definitely lead to swallowing problems.
So with these conditions, diagnosing them accurately is crucial. What tools do doctors use to figure out what's going on?
Well, barium studies and endoscopy are key here.
Okay.
A barium study is a special kind of X-ray where we watch you swallow barium.
Okay.
It highlights the esophagus, and we can see structural problems.
Interesting.
Endoscopy lets us see the lining of the esophagus directly
Got it.
and assess how well it's moving.
So we've got some high-tech tools for diagnosis.
We do.
What about treatment? What can be done to help people with these conditions?
Treatment depends on what type of dysmotility we're talking about.
Right.
For achalasia, we might use medications to relax the lower esophageal sphincter, or a procedure called dilation to widen the opening. Diffuse esophageal spasm is often managed with medications to relax the muscles. Scleroderma, unfortunately, has no cure,
Oh, I see.
but we can manage the symptoms with medications and dietary changes.
Okay, so it sounds like a complex area, but there are options.
There are.
Now, I think it's time to address a more serious topic. Esophageal cancer.
Esophageal cancer,
Yes.
a serious condition.
Yes.
There are two main types,
Okay.
squamous cell carcinoma and adenocarcinoma.
Squamous cell carcinoma and adenocarcinoma.
Yeah. Squamous cell carcinoma usually develops in the upper or middle part of the esophagus.
Okay.
Adenocarcinoma is more common in the lower part, often arising from Barrett's esophagus.
That's that connection to Barrett's esophagus we talked about earlier. So taking GERD seriously and managing it well could be crucial for prevention, right?
You're absolutely right. Managing GERD is very important.
What other risk factors are there for esophageal cancer?
Well, the major ones are smoking and excessive alcohol consumption.
Similar to many other types of cancer.
Exactly. Other risk factors include a diet low in fruits and veggies, exposure to certain industrial chemicals, and of course, chronic GERD.
Okay, so prevention is always key.
Always.
But let's say someone is diagnosed with esophageal cancer. What happens next? How is it diagnosed and treated?
Well, diagnosis usually starts with endoscopy.
Endoscopy.
That allows us to see the esophagus and take biopsies of any suspicious areas.
Okay.
Then we'll use imaging studies,
Like CT scans.
PT scans, yeah,
Okay.
to determine the stage of the cancer, meaning how far it has spread.
I see.
Treatment often involves surgery to remove the tumor if possible, radiation therapy to kill cancer cells, and chemotherapy to target cancer cells throughout the body.
It's amazing what modern medicine can do these days.
It is.
But before we move on to the stomach, are there any other esophageal conditions we should be aware of?
There are a couple more.
Okay.
One is a Mallory-Weiss tear.
A Mallory-Weiss tear.
This is a tear in the lining of the esophagus, usually where it meets the stomach. It's often caused by forceful vomiting.
Ooh, that sounds unpleasant.
It sounds scary, but it usually heals on its own.
Okay, so something to be aware of.
Right.
What else?
Then there's esophageal varices.
Esophageal varices.
These are dilated veins in the esophagus,
Right.
often caused by portal hypertension, which is increased pressure in the portal vein, the one that carries blood from the digestive system to the liver.
Okay.
Think of it like a traffic jam in your veins.
A traffic jam in your veins.
Yeah, this is serious because these veins can rupture and bleed.
Oh, wow. That does sound serious.
It can be life-threatening.
So what causes this portal hypertension in the first place?
Well, the most common cause is cirrhosis of the liver,
Cirrhosis.
which is scarring of the liver.
Right.
It can be caused by lots of things.
Correct what?
Chronic alcohol abuse, hepatitis B or C infection, or even fatty liver disease.
So taking care of your liver is essential for the whole digestive system.
Absolutely, it's all connected.
It is all connected. All right, I think we've thoroughly explored the esophagus.
I think so too.
Are you ready to journey into the powerhouse of digestion?
You mean the stomach.
The stomach.
Lead the way. So, the stomach. This is where the real action of digestion happens.
The stomach.
Breaking down food with powerful acids and enzymes.
It's a tough job.
It is.
But, as you can imagine, this can sometimes lead to problems.
It can.
So let's talk about some of the problems.
Yeah.
First up, gastritis and duodenitis.
Okay.
Is gastritis just a fancy way of saying you have an upset stomach?
It's a little more than just a simple upset stomach. Gastritis refers to inflammation of the stomach lining.
Okay.
Now, this inflammation can be acute, meaning it comes on suddenly,
Okay.
or chronic, meaning it hangs around for a while.
I see.
Acute gastritis is often caused by things like overindulging in alcohol,
Yeah.
using NSAIDs, even stress can bring it on. Chronic gastritis, on the other hand, is more often linked to a bacterial infection.
A bacterial
Wait for it.
infection.
Yeah, by Helicobacter pylori, better known as H. pylori.
H. pylori, that sounds familiar.
It's a common one.
I remember learning about it in school, but I don't recall the details. Can you refresh my memory? Is it something we all have?
It's actually incredibly common.
Wow.
It's estimated that over half the world's population carries it.
Over half. That's a lot.
It is. The interesting thing is most people who have it never even experience any symptoms.
Oh, really?
But for some, it can cause gastritis, peptic ulcers, and even stomach cancer.
Oh, wow. That's pretty unsettling.
Yeah.
So how can you tell if your upset stomach is something more serious like gastritis?
Well, if your symptoms are sticking around or if they're severe, it's definitely worth seeing a doctor.
Makes sense.
Diagnosis usually involves an endoscopy,
Endoscopy.
where a thin, flexible tube with a camera is inserted to examine the stomach lining.
Okay.
And we can take biopsies if we need to.
Okay.
We might also test for H. pylori using a breath test, a blood test, or even a stool sample.
So a few different ways to get to the bottom of it.
It's exactly.
Once you've pinpointed gastritis, what's the treatment approach?
Well, it depends on what's causing the problem.
Right.
If it's H. pylori, we use a combination of antibiotics and acid-suppressing medications to eradicate the bacteria.
So a two-pronged attack.
Exactly. If it's caused by something else, like those NSAIDs we talked about, we'll stop the culprit and provide supportive care, like antacids to neutralize stomach acid.
Okay, that makes a lot of sense.
Yeah.
Now let's move on to peptic ulcer disease. I have a feeling H. pylori is going to make a reappearance here, right?
You bet. Remember those sores that develop in the lining of the stomach or duodenum?
Yeah.
That's peptic ulcer disease. And yes, H. pylori is a major player. It weakens the protective mucus layer that shields your stomach and duodenum from that harsh acid.
So it's like breaking down the walls of a fortress,
Pretty much.
leaving it open to attack. Are there other things that can cause ulcers besides H. pylori?
Definitely. Frequent NSAID use is another big one. It can irritate the stomach lining and make you more susceptible to ulcers. Stress, smoking, and alcohol can also increase your risk.
So it's a combination of things that can lead to these ulcers. Now, how would someone even know if they have an ulcer? Is it just a really bad stomach ache?
Well, the classic symptom is a burning pain in the upper abdomen. It's often described as gnawing or aching, and it often gets worse on an empty stomach. It might radiate to your back.
Oh, that doesn't sound pleasant at all. And I imagine ignoring it isn't really an option.
It's not.
So how do doctors diagnose an ulcer?
Endoscopy is the gold standard, just like with gastritis. It allows us to actually see the ulcer, assess its severity, and take biopsies to test for H. pylori.
Okay, so visual confirmation is key. Once a diagnosis is made, what's the treatment strategy?
Again, the treatment really depends on the cause.
Right.
For H. pylori, we use antibiotics and medications to reduce stomach acid production.
Like PPIs or H2 blockers?
Exactly, to give the ulcer a chance to heal. If NSIs are the problem, we advise the patient to stop taking them or switch to a different type that's easier on the stomach.
So a targeted approach is key. Now, this next one sounds pretty intense. Zollinger-Ellison syndrome.
Zollinger-Ellison syndrome, it's a mouthful.
It is. What can you tell us about it?
It's a rare condition where a gastrin-secreting tumor causes the stomach to make way too much acid.
Too much acid.
Leading to severe peptic ulcers.
Oh, wow.
These tumors are usually found in the pancreas or duodenum.
So where are these tumors usually found?
Pancreas or duodenum. The tricky thing is the symptoms can mimic regular peptic ulcers.
Oh, I see. So it can be difficult to diagnose.
It can.
How do doctors even begin to diagnose it?
Blood tests are crucial. We look for elevated gastrin levels, which would point us towards Zollinger-Ellison syndrome.
Makes sense.
Imaging studies like CT scans or MRIs can help locate the tumor.
So pinpoint the source.
Exactly.
And what about treatment?
The goal is to remove the tumor surgically.
If possible.
If possible, yes. We might also use medications to block acid production and manage symptoms.
Okay, back to cancer. We talked about esophageal cancer, but now let's delve into gastric adenocarcinoma, which is cancer of the stomach lining.
Gastric adenocarcinoma.
What are the risk factors for this type of cancer?
Well, H. pylori is a major risk factor.
H. pylori again.
But other factors play a role too.
Like what?
Smoking.
Okay.
A diet high in salted and smoked foods.
Interesting.
A family history of stomach cancer, and certain genetic predispositions.
So a combination of lifestyle, genetics, and that pesky bacteria. What are some common symptoms people should watch out for?
Early symptoms can be easily missed because they're very similar to indigestion or heartburn. But as the cancer progresses, you might experience persistent indigestion, unintentional weight loss, abdominal pain, nausea, vomiting, and feeling full quickly.
Oh, that doesn't sound good. So those symptoms are similar to other GI issues, which makes early detection tricky.
It does.
So how is gastric adenocarcinoma diagnosed?
Endoscopy with biopsies is the gold standard.
Endoscopy again.
We examine the suspicious tissue under a microscope to confirm the diagnosis. Imaging studies like CT scans and PT scans help us figure out the stage of the cancer.
Meaning how far it has spread.
Exactly.
Okay, so a multi-step process.
Yeah.
What about treatment options?
It depends on the stage of the cancer. It usually involves a combination of things.
Like what?
Surgery to remove the tumor, chemotherapy to kill cancer cells, and radiation therapy to target cancer cells in a specific area.
So a multi-pronged approach to combat the disease.
That's right.
Now, what about gastric lymphoma?
Gastric lymphoma.
That's another type of stomach cancer.
It is. It's cancer of the lymphatic system that affects the stomach.
Okay.
It's much less common than gastric adenocarcinoma, but it's worth knowing about. And guess what? H. pylori infection can increase the risk.
H. pylori really is public enemy number one in the stomach, isn't it? How is gastric lymphoma typically diagnosed?
It's very similar to diagnosing other types of stomach cancer. Endoscopy with biopsies is usually how we do it.
So the diagnostic tools are often the same. It's the interpretation that varies.
Exactly.
What about treatment approaches for gastric lymphoma?
Chemotherapy is the main treatment, sometimes combined with radiation therapy. Surgery might be an option in some cases.
Okay, so different cancers, different approaches, but often similar tools are used.
You got it.
That's fascinating. We've covered so much ground in the stomach. Are you ready to head south?
To the small intestine and colon.
Yes. The small intestine and colon.
Let's go.
Speaker. So those anal fissures are like tiny cuts in a really sensitive area. Ouch.
Yeah.
What are the symptoms someone would experience?
Well, the most common symptom is this sharp pain during bowel movements.
Oh,
it's like a searing pain that can last for a while afterward.
Oh.
Other symptoms can include bleeding, itching, and discharge from the anus.
So definitely not something you want to ignore.
Right.
What's the best way to diagnose those?
A physical exam is usually all that's needed. The doctor will examine the anus and rectum to look for the tear. Sometimes they might use a small scope called an anoscope to get a better look.
Makes sense. So straightforward diagnosis?
Usually, yeah.
What about treatment? How do you soothe those ouchies?
Treatment usually focuses on conservative measures,
Okay.
things that promote healing and reduce the pain. So things like increasing fiber intake to soften stools, using over-the-counter stool softeners, and taking sitz baths,
Just baths.
warm, shallow baths,
Oh, okay.
to soothe the area.
So it's about making those bathroom trips as comfortable as possible. Okay, now let's talk about a condition I think a lot of people have experienced. Hemorrhoids.
Hemorrhoids.
Yes,
Incredibly common.
they are.
There's swollen veins in the anus and lower rectum. Think of them like varicose veins,
Yeah.
but in a much more delicate location.
Delicate is an understatement.
Yeah.
So what causes those veins to become swollen?
It's often related to increased pressure in the veins of the anus and rectum.
Okay.
This pressure can build up from straining during bowel movements. Yeah.
Pregnancy, obesity, even just sitting for long periods of time.
So it's a combination of lifestyle factors and sometimes just the realities of our anatomy. What are the common symptoms of hemorrhoids?
Well, they can cause a variety of symptoms. Pain, itching, bleeding, and even something called prolapse,
Prolapse.
where the hemorrhoid actually protrudes from the anus.
Oh, that does sound alarming. How are hemorrhoids typically diagnosed?
A physical exam is usually all it takes. The doctor will examine the area, but they might also use an anoscope to get a clearer view.
Okay, so similar to anal fissures, what about treatment? How can you get those swollen veins under control?
Treatment depends on how bad your symptoms are.
Okay.
For mild cases, conservative measures like increasing fiber, using over-the-counter hemorrhoid creams, and taking sitz baths are often enough.
So the same soothing strategies as anal fissures. For more severe cases, what are the options?
We might consider procedures like rubber band ligation,
Band ligation.
which involves cutting off the hemorrhoid's blood supply with a rubber band.
Oh, wow. Or sclerotherapy,
Scleral therapy.
which uses a chemical injection to shrink the hemorrhoid. And in some cases, surgery might be necessary to remove the hemorrhoid.
So a range of treatments depending on how bothersome those hemorrhoids are. Now, let's move on to pilonidal disease. What exactly is that?
Pilonidal disease is an infection that develops in the cleft at the top of the buttocks.
Okay.
It's thought to be caused by ingrown hairs that become infected.
So it's like a really unfortunate ingrown hair situation.
Yeah.
What are the typical signs?
The main symptoms are pain, swelling, and redness at the site of the infection. You might also see drainage of pus or blood from the area.
That definitely sounds like an infection. How is it diagnosed?
A physical exam is usually enough to make the diagnosis. Sometimes imaging tests like an ultrasound or an MRI might be used to see the extent of the infection.
I see. And what's the typical treatment approach?
Treatment often involves draining the pus, usually through a small incision in the skin. Antibiotics are often prescribed to help fight the infection, and sometimes surgery might be needed to remove the infected tissue.
Okay. So a range of treatment options depending on the severity of the infection. Now let's talk about a condition that can be a bit embarrassing to discuss. Fecal impaction.
It's not a glamorous topic, but it's an important one.
It is.
Fecal impaction is essentially a hard, dry mass of stool that gets stuck in the rectum. It's more common in older adults and people who are bedridden, but it can happen to anyone.
So it's like a serious traffic jam in your digestive system.
Right.
What typically causes it?
The most common cause is chronic constipation. When constipation isn't addressed, stool can build up in the rectum, becoming hard and dry, making it nearly impossible to pass.
So it's like letting that constipation go unchecked. What are the telltale signs?
Well, symptoms can include abdominal pain, bloating, straining during bowel movements, and leakage of liquid stool,
Oh, I see.
which can be quite embarrassing.
I can imagine. How is fecal impaction diagnosed?
A physical exam, where the doctor examines the rectum, is usually enough to diagnose it. Imaging tests, like an abdominal X-ray, might be ordered to get a clearer picture.
Okay, so a straightforward diagnosis.
Usually, yeah.
And what about treatment? How do you get things moving again?
Treatment involves removing the impacted stool.
Okay.
This can be done manually by the doctor or with the help of enemas or suppositories. Once the impaction is cleared, it's important to address the underlying constipation to prevent it from happening again.
Makes sense. It's about addressing the immediate problem and the root cause.
Right.
All right, I think we've thoroughly explored the rectum and anus.
I think so.
Are you ready for the final frontier?
The appendix.
The appendix.
As I go.
Okay, so the appendix, what exactly is it and what does it do?
Well, that's a question that has puzzled scientists for ages.
Yeah.
It's a small finger-shaped pouch that extends from the colon.
Right.
For a long time, it was considered a useless leftover from evolution, a vestigial organ.
Right.
But recent research suggests it might actually have a role in the immune system,
Oh, interesting.
acting as a safe house for beneficial gut bacteria.
So it's not just a useless little appendage after all. But when most people think of the appendix, they think of appendicitis.
You're right.
Uh,
Appendicitis is an inflammation of the appendix.
Yeah.
And it can be a real medical emergency.
It can be. So what causes the appendix to become inflamed?
It's thought to be caused by a blockage in the appendix,
Okay.
which can be caused by several things like fecal matter, a foreign object, or even a tumor. This blockage traps bacteria inside, leading to inflammation and infection.
Like a pressure cooker situation.
Exactly.
What are the classic signs of appendicitis?
Well, the hallmark symptom is pain in the lower right abdomen.
Okay.
The pain might start around the belly button and then move to the lower right side.
Okay.
Other symptoms can include nausea, vomiting, loss of appetite, fever, and diarrhea or constipation.
So a whole bunch of symptoms that signal trouble. How is appendicitis diagnosed?
It usually involves a physical exam, blood tests to look for signs of infection, and imaging studies like CT scans or ultrasound to visualize the appendix.
Okay, so a multi-pronged approach. What about treatment?
Well, the standard treatment is an appendectomy.
An appendectomy.
That's surgical removal of the appendix. It's important to treat it quickly because a ruptured appendix can be life-threatening.
So it's a surgical emergency. All right, we've reached the pancreas. What can you tell us about this vital organ?
The pancreas is essential for digestion.
Okay.
It produces enzymes that break down food and hormones like insulin, which regulates blood sugar.
Right.
But like any other organ, it can have problems.
Right. Let's start with acute pancreatitis. What does that mean?
Acute pancreatitis is a sudden inflammation of the pancreas.
Okay.
It can range from mild to very serious.
Wow. What are the usual culprits behind acute pancreatitis?
The most common causes are gallstones and alcohol abuse. Gallstones can block the bile duct, which carries digestive enzymes from the pancreas to the small intestine. This blockage causes those enzymes to back up into the pancreas, leading to inflammation and damage.
Okay.
Alcohol abuse can directly damage pancreatic cells.
So it's a combination of blockages and direct damage.
Right.
What are the warning signs?
The most prominent symptom is severe abdominal pain.
Okay.
It often spreads to the back. Other symptoms include nausea, vomiting, fever, rapid heartbeat, and tenderness in the abdomen.
So a lot of intense symptoms.
It can be.
How is it diagnosed?
We start with a physical exam and blood tests, looking for elevated pancreatic enzymes. Imaging, like CT scans or ultrasound, helps us see the pancreas and how bad the inflammation is.
Okay, so a combination of tests to confirm. What about treatment?
Treatment usually involves hospitalization.
Okay.
To manage pain, give intravenous fluids to prevent dehydration, and sometimes antibiotics. In some cases, surgery might be needed to remove gallstones or drain fluid that's built up around the pancreas.
So a range of treatments depending on the severity. Now, what about chronic pancreatitis? How does that differ from the acute form?
Chronic pancreatitis is long-term inflammation of the pancreas. It can cause permanent damage, leading to digestive problems, diabetes, and persistent pain.
That sounds serious. What causes it?
The most common cause is long-term alcohol abuse.
Alcohol again.
Other causes include cystic fibrosis, certain genetic disorders, and repeated bouts of acute pancreatitis. It's like the damage just keeps adding up.
So a cumulative effect. What are the signs?
The symptoms are similar to acute pancreatitis,
Okay.
but they're often less intense and can come and go. Abdominal pain, weight loss, fatty stools, and diabetes are all common.
So it's a more persistent problem than a sudden one.
Right.
How is it diagnosed?
Diagnosis involves a physical exam, blood tests, imaging studies, and sometimes a biopsy to look for damage in the pancreas tissue.
So a thorough evaluation is needed. What about treatment options for chronic pancreatitis?
Treatment focuses on managing symptoms and preventing further damage. Pain management is really important. We might use enzyme supplements to help with digestion, insulin to treat diabetes, and sometimes surgery to remove damaged parts of the pancreas.
Okay, so it's about supporting the pancreas as much as possible.
Yes.
Now let's talk about pancreatic cancer.
Pancreatic cancer.
Yes.
A very challenging disease.
Yeah.
It's often diagnosed late
Really?
because early symptoms can be really subtle or even totally absent.
That's scary. What are the risk factors?
A lot of the usual suspects: smoking, age, family history, diabetes, and obesity.
So similar risk factors to a lot of other cancers.
Yeah.
What are the common signs people should be aware of?
Unfortunately, pancreatic cancer often doesn't show symptoms until it's already advanced.
That's really unfortunate.
It is. When symptoms do appear, they can include pain in the upper abdomen that might radiate to the back, jaundice, which is a yellowing of the skin and eyes, weight loss, loss of appetite, and fatigue.
So a range of symptoms, but they can be hard to catch early.
They can.
What's the best way to diagnose it?
Diagnosis usually involves a physical exam, blood tests, imaging like CT scans or MRI, and sometimes a biopsy to get a tissue sample.
So really thorough investigation. What about treatment?
Treatment depends on the stage of the cancer and the patient's overall health. Options might include surgery to remove the tumor, chemotherapy, radiation therapy, or a combination of those. Palliative care, which focuses on symptom relief and quality of life, is also important.
So a multifaceted approach tailored to each patient.
Exactly.
Okay. Let's move on to the biliary tract, which includes the gallbladder and bile ducts. Let's start with cholelithiasis, better known as gallstones.
Gallstones.
Yes.
These are small, hard deposits that form in the gallbladder.
Okay.
They're usually made of cholesterol, but they can also contain bilirubin, which is a pigment found in bile.
What causes them to form?
The exact cause is still somewhat of a mystery,
Okay.
but there are things that make them more likely.
Like what?
Obesity, losing weight quickly, high cholesterol, family history, and even some medications, like birth control pills.
So a mix of factors. What are the telltale signs?
A lot of people with gallstones don't even have symptoms.
Really?
But when symptoms do happen, it's often because a gallstone has blocked the cystic duct,
The cystic duct?
the tube that connects the gallbladder to the common bile duct.
Okay.
When that happens, bile can't drain properly, and that's when the problems start.
So it's the blockage that causes the issues. What kind of symptoms would someone experience if that happens?
The most common is pain in the upper right abdomen.
Okay.
It might radiate to the back or shoulder. It can be steady or come and go. Often it's worse after eating fatty foods. Other symptoms include nausea, vomiting, fever, and jaundice.
So a lot of unpleasant symptoms, all in that upper abdomen area.
Yeah.
How are gallstones diagnosed?
Diagnosis usually involves a physical exam, blood tests, and imaging like ultrasound or CT scans to see the gallbladder and look for stones.
So similar to some of the other conditions we've talked about,
It is.
what are the treatment options?
It depends if you're having symptoms or not.
Okay.
If you have gallstones but no symptoms, you might not need treatment. But if a gallstone is causing problems, the most common treatment is surgery to remove the gallbladder. It's called a cholecystectomy.
So a wait-and-see approach if they're not causing trouble, but surgery if they are. Makes sense.
Yeah.
Now let's talk about acute cholecystitis, which is inflammation of the gallbladder. What's the connection between gallstones and that?
Acute cholecystitis is almost always caused by a gallstone that's blocking the cystic duct.
Okay.
That blockage traps bile in the gallbladder, causing inflammation and infection.
So it's a complication of the blockage.
Right.
What are the typical symptoms?
The symptoms are very similar to a gallstone attack.
Okay.
Pain in the upper right abdomen that might radiate to the back or shoulder. It can be constant or come and go, and often worsens after fatty foods. Nausea, vomiting, fever, and jaundice are also common.
So it's basically like a gallstone attack, but worse.
Yeah, you could say that.
How is acute cholecystitis diagnosed?
Diagnosis usually involves a physical exam, blood tests to check for inflammation and infection, and imaging like ultrasound or CT scans to look at the gallbladder.
So pretty similar to diagnosing gallstones themselves. What about treatment?
Treatment usually involves going to the hospital
Okay.
to manage the pain, give intravenous fluids, and antibiotics to fight the infection, and usually surgery to remove the gallbladder is recommended.
Okay, so a multi-pronged approach to deal with the infection in the blocked duct. Now let's talk about acute cholangitis, which is an infection of the bile ducts.
Acute cholangitis.
Yes.
This is a medical emergency.
A medical emergency.
It's usually caused by a bacterial infection that develops when a gallstone or some other obstruction blocks the flow of bile through the bile ducts.
Oh, wow. So it's like a dam in the biliary system.
Pretty much.
What are the warning signs?
Acute cholangitis has a classic triad of symptoms: fever, jaundice, and pain in the upper right abdomen.
So infection symptoms and localized pain.
Right, it needs quick medical attention.
Yeah, that sounds serious. How is it diagnosed?
Diagnosis typically involves a physical exam, blood tests to look for infection and liver function problems, and imaging like ultrasound or CT scans to visualize the bile ducts and check for blockages.
Okay, so a full evaluation to understand what's going on.
Yes.
What's the typical treatment?
Treatment usually means going to the hospital
Okay.
for intravenous antibiotics to fight the infection, fluids for hydration, and pain management. Sometimes a procedure called ERCP might be necessary.
ERCP. What's that?
It stands for endoscopic retrograde cholangiopancreatography.
Okay.
It's a minimally invasive procedure where we can see the bile ducts and remove the blockage. Think of it like a tiny plumber going in to clear the pipes.
Ah, that's a good way to think about it. Now let's talk about primary sclerosing cholangitis, or PSC.
PSC.
If-
This is a chronic, progressive disease that causes inflammation and scarring of the bile ducts.
Oh, wow.
This scarring can lead to liver damage, cirrhosis, and even liver failure.
That sounds really serious. What causes it?
The exact cause is unknown.
Oh, wow.
But we think it's an autoimmune disease, meaning the body's immune system is attacking the bile ducts.
The body attacking itself.
Unfortunately.
What are the typical symptoms?
A lot of people don't have any symptoms in the early stages. As the disease progresses, symptoms might include fatigue, itching, jaundice, abdominal pain, and fever.
So a range of symptoms, but they could be easily missed.
They could.
How is PSC diagnosed?
Diagnosis involves blood tests to check liver function, imaging studies like MRCP or ERCP to visualize the bile ducts, and sometimes a liver biopsy.
So a pretty involved process. What about treatment?
There's no cure for PSC,
I see.
but we can manage the symptoms, slow it down, and prevent complications. Treatment often involves medications to reduce inflammation, suppress the immune system, and relieve itching. Surgery to remove damaged bile ducts or a liver transplant might be necessary in some cases.
So a multi-pronged approach to manage a complex disease. Wow, we have covered a lot of ground in this deep dive into gastroenterology.
We have. It really shows how important it is to look after our digestive health.
It really does. We've explored the entire digestive tract from top to bottom, talked about a whole range of conditions, and really highlighted the importance of early detection and treatment. We hope you found this journey informative and maybe even a little bit fascinating. Knowledge is power, and understanding the system can help you make the best choices for your health.
Absolutely. Take care of your guts, folks.
They do a lot for you. Thanks for joining us on this deep dive into gastroenterology.